Presentation for Community Health Resources for Patients with Alzheimer's Disease by Autumn Hunt, Marian University. Alzheimer's disease is a disease that causes problems with memory, thinking, and behavior. The most common cause of dementia, a general term for memory loss and other cognitive abilities that interfere with daily life. Alzheimer's is a progressive disease with an average life expectancy of 4 to 8 years after diagnosis, but can be as long as 20 years depending on the diagnosis. Alzheimer's has no cure, only treatment to reduce the severity of the symptoms. The most common early symptom of Alzheimer's is difficulty remembering newly learned information and confusion about recent events. My patient is a 58-year-old male with moderate Alzheimer's disease. The disease has progressed and the patient is no longer employed and thus has lost his medical insurance. Due to medical expenses, he is about to exhaust his retirement earnings and savings. Qualifying for Social Security insurance disability payments can take time, but it is a solution for those who qualify. My patient lives in Carmel, Indiana, 46032 zip code. This is in Hamilton County, and it's located 10 miles north of downtown Indianapolis, Indiana. The population is approximately 101,000 people. The city is served by Keystone Avenue, I-465, and State Route 31 on 3 of its sides, providing easy access to the surrounding area and to downtown Indianapolis. Nearby towns include Zionsville, Fishers, Noblesville, and Westfield. My patient is wondering what their treatment options are if I don't have active medical insurance. Medicare is a federal health insurance program generally for people aged 65 or older who are receiving Social Security retirement benefits or who are younger than 65 and receive Social Security disability benefits for at least 24 months. Another option, Medicare Advantage, allows you to choose managed care that is more streamlined to your needs. Medigap insurance supplements the person's Medicare coverage. It fills gaps in Medicare coverage such as paying for coinsurance. Medicaid is a program jointly funded by federal and state governments. It is administered by each state. Medicaid pays for medical care for people with very low income and asset levels, and long-term care for people who have used up most of their own money in most circumstances. It also is available to people younger than 65 if they are disabled. Social Security Disability Insurance, SSDI, provides workers younger than age 65 Social Security disability payments. To qualify, the person must meet the Social Security Administration's definition of disability. Supplemental Security Income guarantees a minimum monthly income for people who are age 65 or older, are disabled or blind, and have very limited income and assets. Life insurance and disability insurance would have had to be in place before the diagnosis of the condition, but may be an option for some patients to draw earnings from. Each of the links in this slide connects to a web page with further information. Some of the previously mentioned state and federally funded programs may also provide assistance with the costs of daily living that can help you afford your bills, your medications, and provide other assistance. Those programs are Medicare, Medicaid, and Social Security disability insurance. The following medications may be prescribed to you by your doctor and are used to treat the symptoms of Alzheimer's disease. Donepezil Aricept is a cholinesterase inhibitor prescribed to treat symptoms related to memory, thinking, language, judgment, and other thought processes. These medications prevent the breakdown of acetylcholine, a chemical messenger important for memory and learning. These drugs support communication between nerve cells. Memantine Namida is a glutamate regulator prescribed to improve memory, attention, reason, language, and the ability to perform simple tasks. This type of drug works by regulating the activity of glutamate, a different chemical messenger that helps the brain process information. Other drugs may be prescribed to treat other Alzheimer's disease symptoms. Your doctor may prescribe a number of different medications. To avoid confusion and potential medication interaction, try to fill all prescriptions from the same pharmacy. In-person pickup options are available in your area that include Walgreens, Kroger, Meijer, Carmel Prescription Shop, Giant Eagle Pharmacy, and Apothecary Pharmacy, Carmel. Again, it is very important to only fill your prescriptions from one pharmacy. This is to avoid confusion and potential medication interactions. Try to fill all prescriptions from the same pharmacy. Other options for medication refills include automatic delivery through online pharmacy. Some options include Amazon Pharmacy, GoodRx, or Express Scripts. There are no specific dietary restrictions for a person diagnosed with Alzheimer's disease. However, providing a balanced diet with a variety of foods that offer vegetables, fruits, whole grains, low-fat dairy products, and lean protein foods can help keep the body strong and healthy. Limit foods with high saturated fat and cholesterol. While some fat is essential for health, not all fats are equal. Go light on fats that are bad for heart health, such as butter, solid shortening, lard, and fatty cuts of meats. Cut down on your refined sugars, which are often found in processed foods. Refined sugars contain calories but lack vitamins, minerals, and fiber. You can tame a sweet tooth with healthier options like fruit or juice-sweetened baked goods. Note that in the later stages of Alzheimer's, if appetite loss is a problem, adding sugar to foods may encourage eating. Limit foods with high sodium and use less salt. Most people in the United States consume too much sodium, which affects blood pressure. As an alternative, use spices or herbs to season food. For a person with Alzheimer's or dementia, poor nutrition may increase behavioral symptoms and cause weight loss. It's important to maintain a balanced diet as much as possible. For those living with Alzheimer's disease in the Carmel, Indiana area, there are many community resources that may help with care. There are low-cost nearby adult daycares, medical services through numerous hospital programs, home health care, residential care, hospice, disease education, and 24/7 helplines available. A diagnosis of Alzheimer's disease is not the end of your community engagement or social interactions. To stay connected, the Monon Community Center with the Carmel Clay Parks and Recreation offers many seniors programs. These programs change seasonally. For fall 2021, their programs include Celebration Bingo, Scrabble Club, Knitting Circle, Family Yoga, Book Club, Tai Chi for Health, and Family Zumba. You can contact their website to sign up or reach out for more information. And remember that help is available. If you or someone you know has been diagnosed with Alzheimer's or another dementia, you are not alone. The Alzheimer's Association is the trusted resource for reliable information, education, referral, and support to millions of people affected by the disease. Call the 24/7 helpline, locate your local Alzheimer's Association, use the virtual library for further resources, and go to the Alzheimer's Navigator to create customized action plans and connect with other local support services.